Please help me welcome today's closing keynote speaker, Dr. Lloyd Kolbe, to the stage.
Holly, thanks for that. My wife thinks that I'm working somewhere out on the West Coast here. She has no idea what I'm doing. And I was wondering if I could ask you all a favor, if you wouldn't mind passing up to the front here your pictures of me, those pictorials. I'd love to take them home and help her understand what this is all about. I'd love to see the depictions. Holly, thanks for that introduction, and to all of you, those of you who are ASHA, thank you so much for allowing me the opportunity to present this open letter on national strategies to improve both education and health. Now, when I originally began to write this, I was going to title it On the Future of School Health. And as I began to write, I realized that this letter is not necessarily designed for you all. You know what's in the letter. It really is a letter that's an open letter, if you understand that concept, for the nation's education and health leaders. And if I titled it, I realized, On the Future of School Health, no one would read it. So we've retitled it to be on national strategies to improve both health and education. And if I might, what I'd like to do with you is to basically read that letter, because the future of school health programs really will be determined by the extent to which we can interest, inform, and engage both education leaders and health leaders to collaboratively help build such programs. This letter, thus, is exactly about this conference. It's about building bridges. And I'm happy to say that the letter that you'll hear today will be published in the January 2015 issue of the Journal of School Health. So while you may not have the actual text, you will in a few months. The letter includes 5 sections: an appeal for collaborative actions, an approach, national organizations that could help, benefits and barriers to collaboration, and how we might actually explore national strategies. The letter then is followed by a postscript for ASHA. The first section then, and I'm actually going to read you, if you'll allow me, the letter, the actual letter itself. The letter reads, October 11th, 2014, Dear colleagues. The first section, an appeal for national discussions about collaborative actions to improve both education and health. Since the early 1900s, education and health professionals have been developing a wide range of means that K-12 schools and colleges and universities, in addition, could use to concomitantly improve both the health and education of their students. These means efficiently can be organized into what sometimes are called school health or college health programs. The implementation of such programs could become one of the most effective strategies available to improve the health of American students. And by so doing, simultaneously could become one of the most effective strategies available to improve education achievement as well. Health and education are reciprocally interactive. Healthier students simply learn better, and more educated adults live longer and healthier. Education, health, and related organizations have recognized this for decades now. Indeed, local schools and colleges increasingly are asking health and related organizations within their own communities to work with them more collaboratively, especially to meet the needs of those populations at greatest risk for poor health and poor education outcomes. And usually those populations are at risk for both of those outcomes. Yet we, as a nation, have not convened a purposeful discussion about national actions that education, health, and related organizations together might take to help local schools and colleges implement such programs. With this letter, I asked the national governmental and non-governmental organizations listed below to consider whether their organizations might participate in a collaborative discussion about possible national actions they each might take independently and collaboratively with others. As a retired public health and education worker, I'm grateful for opportunities I've had to work with and learn from most of the organizations listed as they endeavored at one time or another to nurture both the education and health of interested of school and college students and staff. I also offered this letter to interested school and college staff, students, parents, and communities to inform and stimulate a national dialogue about such actions. The second section then is on a whole school, whole community, whole child approach. Health organizations, as many of you know who work in those organizations, often identify 4 broad societal structures that markedly can improve health, including schools, and I would add colleges here, work sites, healthcare organizations, and broader communities in which these 3 structures actually function. What we call community health and public health has grown into a discipline that focuses research, development, and training on engaging a wide range of partners to collaboratively and measurably improve health. School and college health might become a discipline that similarly focuses research, development, and training on engaging a wide range of partners to collaboratively and measurably improve both education and health. Indeed, as you all sitting here know well, our nation's K-12 education system includes about 130,000 schools, public and private, with 5 million teachers and other school staff to help nurture and educate 55 million K-12 students every school day, usually for 13 years, the most formative years of their lives. In addition, our higher education system includes about 7,400 colleges with 4 million instructional and non-instructional staff to help foster and educate 22 million college students each year. Thus, our K-12 schools and our colleges build the foundation for the interdependent education, health, and productivity of this nation. As outlined by the model in Figure 1, recently developed by the education sector's ASCD and the health sector's U.S. Centers for Disease Control and Prevention, modern K-12 school health programs purposely could unite the efforts of various organizations to collaboratively implement a whole school, whole community, whole child approach to concomitantly improve both education as health, as could college health programs that employ a similar approach. National organizations that could help each other improve both education and health. Essential to the widespread implementation of such approaches in the U.S. are the national organizations that I'll list in Table 1, which are grouped into 6 categories. To lend global perspective, I've included several international organizations. The name of nearly every organization listed in Table 1 is actually hyperlinked in white to information about often numerous actions that each one of these organizations already is implementing to improve both education and health. If I've missed an organization that should be involved, I hope you'll let me know at the email address that will conclude this letter. And let me say, aside from the letter, that for those of you that are attending, the hyperlinks will actually be in the slides. If you'd like the slides, just write to me. I'd be happy to send them to you. It would be impossible in this short period of time to show you all the activities that these organizations are implemented. But if you hit the hyperlinks, you can see all of the things that they're doing to improve both education and health. As listed in Table 1, the first category of national organizations that could help each other improve both education and health includes K-12 education organizations that have mandates, expertise, and resources to improve K-12 education outcomes, outcomes that markedly affect health. Listed here are K through 12 organizations 1 through 9, and here are K through 12 organizations 10 through 16. The second category includes health organizations that have mandates, expertise, and resources to improve health outcomes, outcomes that clearly influence education. Here are health organizations 1 through 10, 11 through 18, 19 through 28, and health organizations 29 and 30. A third category includes other relevant organizations that have unique capacities to improve both education and health. These include national government, philanthropic, business, youth-serving, media, and related organizations. Here are relevant organizations 1 through 10. Here are 11 through 19. And here, relevant organizations 20 and 21. A fourth category includes school health organizations that help K through 12 schools implement broad school health programs across a range of the 10 school health components depicted in the whole school, whole community, whole child, or WSCC model. Importantly, several of these organizations variously have been working to increase national collaboration. Here are school health organizations 1 through 10 and 11 through 15. The fifth category includes school health component organizations that help K through 12 schools respectively implement each of the 10 components of the WSCC model, grouped into the following 10 subcategories. Subcategory 1, school health education organizations. Subcategory 2, school physical education and physical activity organizations. It's important to say within this component, the National Physical Activity Plan Alliance convenes a coalition of national organizations that has developed and currently is implementing a strategic plan to improve physical activity in the U.S., including a strategic plan to improve school physical activity. Subcategory 3, school nutrition, environment, and services organizations. Subcategory 4, school health services organizations. Subcategory 5, school counseling, psychological, and social service organizations. Subcategory 6, school social and emotional climate organizations. Subcategory 7, school physical environment organizations. Subcategory 8, school employee wellness organizations. Subcategory 9, school family involvement organizations. And subcategory 10, school community involvement organizations. Within this component, the Coalition for Community Schools convenes an alliance of national, state, and local education, health, and related organizations to help build partnerships between schools and other community resources. Now, the sixth and last full category of national organizations includes higher education organizations that markedly can improve both the education and the health of our nation in at least 2 ways. Let's see. First, college health programs that incorporate components similar to the 10 above could improve the education and health of our nation's college students. Second, college faculty who conduct research, development, and pre-service and in-service training for various education, health, and other relevant professionals could work more collaboratively with each other and with K through 12 schools to implement a WSCC approach. Indeed, our colleges of education, public health, nursing, medicine, dentistry, social work, and other relevant colleges will determine the extent to which professionals they train are inclined to work with each other and with K through 12 schools to jointly improve both education and health. Investment in applied interdisciplinary and interdisciplinary research, development, and training could help these colleges establish new paradigms, new strategies, new partnerships to improve both education and health. I've written this, I would say, as an aside, largely for NIH to give them something to think about. Listed here are national higher education organizations that could help. Now, we could have long discussions about any one of these sets of lists, but the bottom line is that the sheer number of national organizations listed across these 6 categories and the many disparate actions that they already are implementing reflect the great interest in, complexity, and underdeveloped potential for our nation to simultaneously improve both education and health. Benefits and barriers to collaboration. Among the national organizations listed, none has the singular means to improve either education or health by itself. We each need the other to succeed if we're to encourage and enable local schools and communities to implement a WSCC approach. National organizations across the 6 categories will need to support, if not model, such a collaborative approach. Indeed, we've learned much during recent decades, too much to recount here, to summarize here, about the theory and practices, advantages and disadvantages, and means to build and sustain purposeful collaboration, cooperation, coalitions among organizations with similar, if not interdependent, values, interests, and goals. If we prudently could unite the expertise, perspectives, resources, communication, visibility, and political support of national education, health, and related organizations to help schools and colleges implement a WSCC approach, we synergistically could increase the impact of each sector, each organization involved. We could build a lasting national base for new means to improve both education and health. We could accomplish that which otherwise we cannot. We remain, however, remarkably divided within and across education, health, and related sectors, divided within and across unconnected efforts to implement each one of the 10 WSCC model components, divided by unrelated efforts of K-12 schools and higher education to improve both education and health. We remain divided by the titles and models we use to characterize collaborative approaches to improving education and health, be they coordinated school health programs, healthy schools, safe and drug-free schools, college health programs, or a WSCC approach. We remain divided by the very organizations within which, or with which we affiliate, each understandably seeking to preserve its own agenda, independence, effectiveness, visibility, constituents, funding. Each asking the same local school administrator to address our widening array of important education and health problems. Finally, we remain divided by the yet-to-be-examined assessment of whether a national collaboration to improve both education and health might be worth the effort of our own organization to explore and help shape. How we might explore national strategies. There may be various ways for our nation to explore and develop collaborative national strategies to improve both education and health. One way often suggested is for one or more well-established organizations to convene a summit of interested national education, health, and related organizations. The convening organizations might identify and provide logistical support for a small cadre of senior statespersons within and across sectors to help plan and convene the summit, with assistance from those who have experience in building national collaborations. The purpose of the summit might be to produce a report that summarizes actions national organizations already are taking to improve both education and health, and that articulates the most feasible, productive, sustainable actions each interested organization additionally might take independently and collaboratively. Such a report might synthesize the aggregated actions into a practical plan, into means for building cultures of health and education that mutually support each other, into a roadmap for national strategies that can better improve the lives of nearly 80 million American school and college students each year for generations to come. If invited, would your organization participate in such an exploration? Today, the question is rhetorical, meant to stir discussion, prompt reactions, that in turn will determine whether and when each organization actually may be invited to answer. Thanks for considering this letter. I end the letter with these simple signature lines shown here. And I've added the following postscript for the American School Health Association. If invited to address the foregoing letter to any of the national organizations listed in Table 1, I would add a postscript to highlight the unique and vital role that organization can play to improve both education and health. For nearly 90 years now, ASHA progressively has brought together 5 often overlapping types of members with complementary interests and abilities. First, ASHA brings together education, health, school health, and related professionals involved in implementing a WSCC approach to improve both education and health. Many of these ASHA members are also members of national organizations listed in the 4 categories of Table 1. Second, ASHA brings together those who implement each of the 10 components of a WSCC approach, many of whom also are members of national organizations listed in the 5th category. Third, ASHA brings together higher education faculty and their undergraduate, graduate, and postgraduate students who conduct research, development, and training in colleges of education, public health, nursing, medicine, dentistry, social work, and other disciplines to improve both education and health. Fourth, especially because ASHA was one of the first national school health organizations in the world, it continues to attract members from other nations, from and with whom we all learn much. Fifth, ASHA attracts parents, concerned community members, and other individuals interested in implementing a WSCC approach in their own schools and communities. Thus, ASHA is unique and vital because it provides a means for those employed by local, state, and national education, health, and other related organizations to work with each other, with concerned parents and community members, with colleagues in higher education and other nations, to collaboratively and synergistically improve each of the 10 components as part of a WSCC approach. ASHA helped build the foundation for such a collaborative approach in the United States through its website and its annual conference, its materials, its advocacy, its networking, and its virtual communities of interest, its wide-ranging initiatives, and its Journal of School Health. You, the members of ASHA, are the current incarnation of a remarkable organization that historically evolved to improve both the health and education of many generations of Americans that have come before us. Today, what each of you do together as an organization that continues to evolve correspondingly will help define and strengthen our nation's efforts to improve the lives of many more generations tomorrow. Thanks for your indispensable leadership and for being such wonderful colleagues. Thanks.
Thank you, Dr. Kolbe. I think we have a few minutes if folks have questions. If you'll come back up, Dr. Kolbe, and we'll...
It's a good question. Sooner, obviously, would be better than later. We've tried to keep the ideas in this paper. This is the first time they've been released. They'll be published in January. That will be the mechanism to try to get the letter out to the national organizations that are listed. Our hope is that these national organizations, there may be organizations that are not on the list saying, I should be on that list, and that if there are organizations that might step up to the plate to convene and begin exploring how to do this with others. On the one hand, there could be many organizations that would be interested in doing this and pulling things together. Are they the right organizations? Are they sufficiently well-staffed and resourced to do something this significant? That's going to be a question. So I think, as usual, Jeff, you always put your finger on the critical point. My response would be sooner rather than later. Will it take 5 years, 10 years? Will it take 1 year? Don't know. Yeah. Part of it was designed not to be overly prescriptive and say, well, this is what ought to be done. I don't know any better than others what ought to be done. But I think if we could get some wise counsel around the table and think about how to very carefully shape a summit before you actually invite people to come, that the summit could bear a greater potential to be productive, and to develop a report from the summit that could be long-standing. So thank you for that question. Dr. Holson.
In the slides, you had some that were highlighted in yellow. Was there a reason for that? That's number one. But secondly, is there a possibility that your letter could be released to those of us who are the new board members so that we can start to become proactive and not wait till January?
I'm going to kick that to the good Dr. McDermott. We don't want to kind of steal the thunder from YLA, the publishers, or the Journal of School Health, so didn't want to get it out in its full form. Thought that this would be the ideas, and you'll have the hyperlinks to the slides so you can see it, so the basic ideas are out there. And I would leave it up to ASHA on how they want to handle it. I think one of the things we've learned in the past is if stuff like this comes out in dribbles and drabs, it doesn't have an impact as much as if you release it all at one time. Again, that was part of my genuine thanks to ASHA for allowing the opportunity to present the letter at this conference. To your question about why some of them are not hyperlinked, those are organizations, when you go to their website, there's nothing on school health. Every other one of those organizations is doing something. I was just so sad to see that the American Medical Association is no longer doing anything on school health when ASHA used to be great partners with AMA. AAP is doing great stuff. AMA is kind of not doing anything anymore. So those organizations, two important among them, the American Association of Colleges of Teacher Education and the Association of Schools of Public Health and Programs. I forget how they exactly title it. But when you go onto their website, there's no school health there. And it just points out maybe these are some organizations that would be great to work with, not in a way to say, gee, you're not doing anything, but to say here's some potential partners that might be important to work with. Great.
Hello. Although you mentioned that the agenda items are not on the table yet, how likely is it that an agenda item could be that a mandated certified health teacher be at the elementary school rather than the elementary teachers and the very little regulation that takes place from a proactive standpoint?
Good question. I think those are the types of issues that might evolve from a summit where these issues are kind of put on the table in front of the nation, or evolve from actually presenting here and getting discussion going and finding out, well, what are the priority things that ought to be done and which types of things could wait to be addressed in the future. So I'm not sure when and how that particular issue might be addressed. I'm surprised there aren't questions, although I'll use yours if I might, to say, well, are these organizations in the right categories and subcategories? I didn't want to explain all the reasoning for each application or listing each organization, but really didn't want to list a national organization more than once. Many could be listed more than once. So how do they fit in, and what are the issues in school health education? Well, the National Coalition and SOFI and all those organizations are kind of working together. That's their component, but they need to be integrated. I think what we don't say, and I know I haven't said it well enough in this letter, I don't know how to say it better in a short letter, but we neglect explaining to people, because sometimes it's a stretch, but each one of these components is important, it's critical, and it has effect, but it's that synergy that bringing them together can have a much greater effect, can be much more efficient, can amplify the effects. And that's what ASHA has done, has always done, has brought together those organizations, has brought together those individuals with different interests, and allow the nurses and the health educators and the school counselors to talk together about working as a group, united, cohesive, pushing together, where we all have our own independent interests, but can we put those interests together in such a way that we are still school nurses? Wonderful school nurse president of ASHA, and she's pushing on the broader school health program. There aren't many other organizations that do that. You saw all what I would propose are the national school health organizations, wonderful organizations that basically do similar types of things. So with that,
I see with the vision for this national summit, what do you see as the similarities and or differences between what vision you have and what we do now with Healthy People, which is also a national project and involves a very large number of major players?
Mm-hmm. Very, very good question. If you look at we're in the 4th iteration of our Healthy People 2020 objectives for the nation, and I've gone through each one of the 4 iterations, so I forget what number we're up to, but we're probably at, 430, I'm guessing, 430 objectives in there that cross the whole span of the health of the nation, from environmental health to prenatal health to the whole list. We're talking about a way to achieve those national objectives by uniting the sectors, at least education and health, bringing them together. And if you were to look at each of those 4 iterations of national health objectives, there was a push, a call for that to occur. But we haven't gotten there yet. We just haven't pulled the trigger. We'll say to Denver schools, gee, you ought to get the organizations that are in Denver together around the table, the pediatricians and the nurses and the school food service people and the community, and bring them together. We haven't done that at the national level. We say do it at the local level, but we haven't modeled that. We haven't gotten our national organizations that represent the school superintendents to say, yeah, this is important to do at the local level. We stand behind this. We're interested in this, and we want to figure out how to provide support. And that's where I think each one of you come in as members who are tried and true. I mean, you're staying to the last day of the ASHA conference. You can always tell the people who are passionate and committed, not to say that a lot of passionate and committed people didn't have things to do to go back home. Having said that, and did my diplomatic dance right there, but you can make this happen. When you go back, and if you belong to the NEA, and Jim Bender from NEA is here, to say, gee, NEA, shouldn't you be at the table? Shouldn't you be pushing on this? Shouldn't you be working on this? If we each one of us had that same vision, We don't know exactly what to do, but we know we need to come together and figure out what to do at the national level. Folks are doing great things at the local level. We've yet to do it at the national level, and ASHA can provide incredible leadership for doing that. And with that, thank you so much for the time and to be with you. It's just been fun.